Thank you for joining us today. My name is Melissa Rosen, and I am the Director of Community Education at Sharsheret. Today, you are joining a program entitled Creating a Caring Community to Support Those in Need, a conversation with Sharsheret and the JCC Association. But I actually want to begin by saying thank you to you for caring enough to take the time to explore this incredibly important topic and one that is so often overlooked. And there is so much we can do to ease the burden of those facing a diagnosis. I also want to take a moment to thank Samantha Cohn from the JCC Association for helping us to pull this together. For those of you who are unfamiliar, Sharsheret is a Jewish national nonprofit organization that provides free psychosocial support to women and their families who are facing breast or ovarian cancer, or those at high risk. And while I'm going to speak through the lens of Judaism and through the lens of breast cancer, as you will hear, when I speak, this is a topic that is so easily extrapolated to any community, any cancer, and even any other diagnosis. In fact, much of the practical tips can be used not just for someone facing illness, but for anyone facing a difficult time in their lives. So let's get started. But before we do, I just want to say, I want this to be a casual presentation. So if you have a comment, a question, simply unmute yourself and share. Alternatively, you can place your comment in the chat box or the question in the chat box below. But either way, let's make this interactive. So today, I'm going to talk about how as individuals we can support those facing difficult life circumstances. And we're going to talk together about how JCCs can become supportive communities. And like I said, let's make time, not just at the end, but throughout, for this to be a conversation and to have questions be asked and answered by not just me, but by all of us. Okay. Receiving a breast cancer diagnosis is overwhelming and isolating and frightening. Receiving any serious diagnosis is. And I want to make a statement that may seem counterintuitive. Breast cancer, illness, is not just a personal issue, but a communal issue as well. And the Jewish community can be an amazing source of comfort and support to anyone facing difficult times. I know myself from 2 different cancer diagnoses how wonderful the community can be. Within a week, each time, I had childcare, rides, meals, and more. I knew that I had good friends, and perhaps most importantly, I knew that I was a valued part of the community. And that's really, in a nutshell, right there. We want to ensure that people facing difficult times in our own communities know that they are a valued member of the community, despite their diagnosis, despite the difficult times that they're going through. Yet recently, Sharsheret has received some calls from women that we've helped. They were concerned that people they knew, friends, colleagues, were upset with them. And of course, we were surprised by this. Why? How could that possibly be? But it turned out that when someone asked for help, they didn't have an answer. And those well-meaning souls were frustrated that they could not help. So it is possible that offering support isn't as instinctive as we believe. And with that in mind, let's explore the best ways that we can offer support to someone in need. I'm going to give you 3 things we're going to talk about. And this is what people can do on a one-to-one basis. Then we'll move into what community organizations can do. So the first is say something. I have a dear friend who was diagnosed with breast cancer a few years ago. We went out for coffee and she confided in me. So many people had approached her, offering her words of comfort, but 2 of our close friends had not. She knew she shouldn't be wasting her energy or focusing on this, but she shared that she wasn't sure she could get beyond the hurt. The thing is that cancer stirs difficult emotions in all of us. Still, it is never wise to ignore someone's diagnosis. It is, however, perfectly okay to say, I don't know what to say, or to say simply, I'm thinking of you, and just acknowledging the diagnosis. Of course, there are times you shouldn't say something. Saying things such as, I know just how you feel, or I have a friend who had that, is simply not relevant. Everyone's cancer is different. And in fact, breast cancer in and of itself is 11 distinct diagnoses, each with their own treatment plans, protocols, and outcomes. Additionally, everybody reacts to treatment differently. So even if you knew someone who had the exact same diagnosis and was on the exact same treatment protocols, that person is probably not reacting the same way to the person you know. Every person's cancer experience or illness experience is uniquely their own. So what should you do? You should follow a person's lead and validate their feelings. Someone with a diagnosis may want to talk specifically about things other than her cancer. Maybe this is the time to share a little harmless gossip to distract her. Or she may want to limit the cancer conversation to logistics, meals, surgeries, childcare. If that's the case, help her organize. Yet again, she may want to talk about her diagnosis. Let her vent her frustrations and share her fears. But please don't feel you need to solve her problems. You can't. Just be there to listen, and that's a gift. Okay, so we talked about saying something. Number 2, let's talk about doing something. Cancer treatment is debilitating and can be overwhelming, but please, please, please don't ask how you can help them, what they need. Doing that places the onus on the patient. It's possible the patient doesn't know what she needs. It's also incredibly difficult for some of us to ask for help, especially when we're used to being the person who offers help. So the best thing to do is to actually offer specifics. Say, I'm going to Target. Do you need toilet paper, milk? Can I pick up a magazine for you? Or how about saying something like, I'd like to drop off dinner. Is Thursday at 6 okay? Don't worry, if you don't need it right now, it can be frozen. Or possibly something like, I'm taking my kids bowling on Sunday. Or maybe these days it's, I'm taking my kids to a park for a socially distanced game of catch or whatever. Would your kids like to join us? Those are really wonderful things. There are other things you can do that require a bit more, but are also critically important. One of the most helpful things I found in my own experience was to have a friend accompany me to all of my appointments. The information is often foreign and overwhelming, and being upset makes it even harder to process. My friend took notes, and I referred to them often. If this is something you would feel comfortable with, you can offer your services to a good friend. Keep in mind that what you offer has to be appropriate for the relationship you had prior to diagnosis. You could also offer to be a conduit of information to friends and community members. It's exhausting to constantly need to respond to well-meaning inquiries. Or you might coordinate meals. There are 2 great websites that help. Take Them a Meal and Meal Train, and I know others are popping up with some frequency. Third, you might choose to support the cause. You could walk in a breast cancer race in her honor. A lot of people these days are blogging almost as a way to keep a diary during their cancer experience. So if she is, please be sure to read it. But you could even make an appropriate donation in her honor, or donate your hair to an organization that creates wigs for those in chemotherapy. These are only a few of the so many things that can be done to support someone facing cancer. I have a handout that I will email later today to each of you that lists many more specific, concrete ways. But whatever you do, the most important thing is to let the patient set the tone. Ask, but don't be offended if she doesn't accept. She may have all the meals she needs. Be too tired to go out for coffee, or be immunocompromised and not able to enjoy a visit. Inquire, but don't be offended if she doesn't respond. In fact, ending a card, an email, a text message with the phrase "no need to respond" is a huge gift in and of itself. And let them know that Sharsheret is there for them. By the way, a good deal of the women we work with, their first point of contact with Sharsheret was through a friend or family member, someone else who called to get information to help a friend through the diagnostic process. Sharsheret has several national free support programs to help women and their families navigate through the cancer experience. Okay, so we've discussed a few things that you can do as individuals to help someone you know facing breast or ovarian cancer or another difficult diagnosis. Do any of you have other examples of things that you have done that you have found to be helpful? No? So then I'm glad that, oh, Shauna.
So I think if you're talking about people who are already connected with someone at Sharsheret, I think the thing that starts a lot of this process is just actually hearing from somebody who's been there, because everything is so new. And even though you know that, I don't know the exact amount of people have been through breast cancer, even maybe your exact kind, actually hearing voice of somebody who's literally been through it just changes things and just makes it a little more less frightening, also because they're talking to you and they're not a statistic. So that's, I think, a huge piece. And I think that part just kind of also, even that person, like using humor a little bit. I think humor, depending on the person, is a huge piece. Also, depending on the stage you're at in terms of treatment or whatever's going on. I think sometimes humor is a thing. I mean, I have a friend who did a bye-bye boobies party. That would not have been something I would have done, but for her, it was a huge thing that was like incredible and was very empowering. And she actually taught her friends, because she's very young, about Sharsheret and about checking yourself and all sorts of things. So she used her own diagnosis as a teachable moment. So I think some of those kinds of things are very powerful.
Yeah, you know, cancer humor is its own genre. It's definitely a thing for some people. Okay, so let's transition a little bit to how community organizations and communities as a whole can work to provide support, to create a caring community, a community of comfort. And let me start by reiterating an interesting fact. Study after study has actually proven that patients, any patient, not just breast cancer, whose non-medical needs are met have better medical outcomes, right? That does, it seems kind of counterintuitive. What do childcare, finances, Jewish holidays, family celebrations have to do with better medical outcomes? Well, the studies prove that patients whose non-medical needs are met get through treatment with fewer complications. They live longer. They don't just survive, but they thrive. So again, what are non-medical needs? Like I said, they could be financial, they could be childcare. It could simply be the ability to not worry about details such as rides to treatment or meals for family. It may also be addressing someone's cultural or religious needs, perhaps helping them prepare for Shabbat or a holiday. Like I said, a celebration. There have been a lot of graduations that have just happened, and I guess a few that are still happening, despite whatever special needs they may have at the moment. So what can a community as a whole do to help the members meet their non-medical needs? So the first thing they can do is educate, right? The JCC is a great place to offer awareness programs, not only to train and support caregivers, but to educate about genetics and hereditary cancers within our community. I love when JCCs do this kind of programming because it's so easy for us to finish the program saying, like, we've taught you so many, giving you so many tools about how to be proactive about your health, and we're here in a JCC, or we're on a webinar sponsored by your JCC, and they have those tools year-round to help you meet those goals. In terms of caregiving, right, the JCCs can offer programs to give men and women the tool, not caregiving, the tools to be proactive about their health, to be empowered to take care of themselves. And providing this type of education sets a tone in the community that prioritizes self-care, which is something that as adults, we're not so good at. And so when our community leaders prioritize self-care, it's a subtle message to ourselves that we should be doing it as well. Okay, so we talked about education. What about respect? Every patient has the right to decide how much information to disclose and who to share it with. Thankfully, the great majority of Jewish professionals make themselves available and are welcoming to members in need. In fact, at Sharsheret, we encourage women to consider their rabbi a part of their treatment team to offer important spiritual support, and other Jewish professionals a part of their treatment team to offer community support. So if someone in your community shares a diagnosis with you as a Jewish professional or a leader in the Jewish community, it is perfectly acceptable for them to ask you not to share that information with anyone else. Not the organization's president, not your spouse or partner, not anyone. A patient is allowed to say it's okay to share with this person, but not the rest of the community. You know, I know, a person could say to you, I know our JCC has a caring community committee. It's okay to share with them, but remember, please don't tell anybody else. I also want to point out that it's perfectly acceptable for someone to change their minds. Perhaps they have been open, but their status has changed. Maybe a cancer has reoccurred, and they're allowed to not share that change with people. People have their own reasons for how they decide to share their diagnosis, or if they decide to share their diagnosis. They may want to share in the knowledge and experience of community members who have been there before, similar to what Shauna was saying. They may want to be private for the sake of their kids. There are so many factors that go into disclosure decisions, so please, please respect those decisions. In addition, there's support, right? We talked about education, we talked about respect, and now let's talk about support. There are practical things that JCCs and other Jewish organizations can do in addition to what individuals do that create a community of care. So if a woman is willing, or a patient is willing and open about her diagnosis, the JCC can send updates via email. Updates as simple as, we want you to know that our dear friend so-and-so got through surgery and her recovery has been easy. And you might even add, she has the following needs. If you can provide a meal for her in the next couple of weeks, click here. If you can provide, homework help for her children, click here, that kind of stuff. Not only does that take the burden off of an exhausted patient from responding to so many well-meaning inquiries, but it keeps community members updated. For those members who want to maintain a level of privacy, many organizations can still offer support. They may already have creative and active committees that visit people in hospitals or help meet the needs of those people who are facing illness. But obviously, people in those committees have been trained to know that what they learn because of their participation in a committee is confidential, right? This is a good time to say that a Bikor Cholim committee or a caring community committee, it's like Vegas. What happens there stays there. You should never be sharing any information. And even for someone who wants to maintain their total privacy, which to reaffirm is completely appropriate, there are things that can be done as a community. Some organizations have set up special committees that allow a member who is facing illness to receive meals or have errands run. The request is public, but the recipients are not known by more than 1 or 2 members. So for instance, if you have somebody who is facing a diagnosis in your JCC community, and they could use some help, but they don't want to share their diagnosis with anybody, an email can be sent out saying, we have a dear member of our community who is facing a difficult time, wishes to remain private, but we could use meals, or if you're, or a supermarket run, if you'd like to participate, meals and anything purchased can be dropped off at the JCC office, and we will get that to this family. I want to reiterate that a cancer diagnosis, any diagnosis, is so overwhelming and so challenging. But more than that, it can be alienating. And so, yes, people's physical needs need to be met. But I think one of the most important things, and I alluded to this at the start, I think one of the most important things is for someone who's facing illness in the community not to feel like they are your good deed for the day, not to feel like, they're a chesed project, or whatever phrase you want to use. The important thing is to help by sharing the message that they are still an integral, respected, and important member of the community. By the way, a cancer diagnosis is a life-changing experience. The way the Jewish community comes together to respect and support a family may well determine that family's relationship to the community moving forward. And not only does a community coming together to support those in need benefit those in need, but it benefits the community as a whole. So if support comes through the JCC, for example, we know that not only does the family who's facing illness feel closer to the JCC, but those who have supported that family feel closer to the JCC. So it strengthens the entire community, the fabric of the entire community. I want to take a break here for 1 second and see if your organizations, whether it's the JCC you are a part of or another organization you are a part of, have offered similar things, different things that you have found to be helpful. Or if there is a need that I haven't addressed yet that you want to discuss. Okay, you know what? I'm going to finish up and we are going to see if there are any questions afterward. The last section I want to talk about is really about caring for the caregiver. As a caregiver, whether a spouse, a parent, an adult child, a best friend, a neighbor, a colleague, anyone offering support, I encourage you to be aware of your own needs. That person's cancer experience will have an impact on you too, no matter your relationship to that person. So it's important to have a support system of your own. Again, whether a friend, a colleague, a rabbi, a mental health professional. As a caregiver, friend, or family member, you can also call Sharsheret and speak with one of our staff members, one of our social workers, to receive support through our Family Focus program, which not only helps with practical ways to support someone you care for, but also gives you the opportunity to vent without burdening them, share your own fears, your own concerns, anger, whatever it may be. One of the most beautiful stories that I've heard that has come out of Sharsheret is a Sharsheret caller who was the father of a young woman who had been diagnosed with breast cancer. And he was really struggling with his role because her husband was really her primary caregiver. Sure, they brought meals in, they babysit their grandchildren, but he was really struggling as to what more he could do. And we spoke with him and really, had an ongoing conversation and made some practical suggestions. But honestly, I think the most important thing that we did for this gentleman was redefine what a caregiver is. And when I mentioned all those different categories earlier, we really meant it. Caregiver is a beautiful term. It is an important title, and anybody who's providing support, whether it's a spouse, an adult child, a parent, whether it's a best friend, a colleague, a neighbor, whoever it is is worthy of that title and deserves the support that come along with it. So by taking care of yourself, you'll be better able to support the person you care about. We've addressed what each of you can do to support someone you know facing a difficult diagnosis, but of course, this is just the beginning of an ongoing conversation. I would love to take a few minutes to talk more right now. Certainly, if you prefer private conversation because of something going on in your own life, or you want to talk specifically about programming at your own JCC, I am available by email. We can schedule a call. My email is mrosen, MROSEN, @sharsheret.org. I will spell Sharsheret because as a transliteration, it is impossible to spell. So we spell it SHARSHERET.org. mrosen@sharsheret.org. Okay. I'd love for everybody to unmute themselves, share questions, share experiences, share concerns that I didn't address, or even share, Sam, if you want, share some ideas for moving these programs forward in local JCCs or things like that.
So we've done, I'm in Columbus, Ohio. And we have done several different things in terms of Sharsheret. A lot of them have been kind of like collaborations. We collaborated with Mominette. I don't know if you all have Mominette. Mominette is an amazing group of people who are incredible to work with here. I don't know about anywhere else. And they have a tremendous amount of energy and drive. So doing a program with them was a lot of fun. We brought in an expert, a genetics expert from the breast center here, and we did a really cool educational kind of thing. And then we had a couple of survivors tell a little of their story to like make it a little more personal and also to just give people a little bit of a perspective. And that was really, really fun. And then we've done, we did Pink Day. We've done that several times, which we did actually, one of the years, I do it twice. I do it upstairs and downstairs in our JCC. So I do it in the fitness center because that's where we get the most traffic. So we've like kind of plop ourselves in the fitness center and just tons and tons of people come and just chat and talk and whatever. And then we also, the other half of the day, we go upstairs like by the entrance. So people are coming in to go to the preschool or the pool or whatever. So they'll see us there also. Well, I guess it's in February, they weren't going to the pool. But so we've done things like that. There was once a panel, which I get very nervous about panels because sometimes people think they should be giving out medical advice. That makes me very uncomfortable. So I'm not a huge fan of like so many panels unless it's someone from Sharsheret. But I'm always looking for other ideas of things that we could expand. I tried to work with a woman who does a lot of holistic meditation. We tried to start a group. Nobody committed. That was frustrating. But if anyone has things that have really worked, I'd love to try some more things. We definitely have lots of people I think who would be interested. It's always hard to figure out, do it in an evening, do it during the day, those programming questions, but I'd love to hear about what other people are doing that have worked.
Hi, this is Debbie. I'm from St. Louis, and Shayna, hi. I have 2 Buckeye children that live in Columbus. We'll have to meet sometime when I'm there.
Yeah, exactly.
We do a lot of similar things to what Shayna talked about. We do have a support group that has been around, and I would say it's a hybrid between a traditional support group and an experiential support group. At least once a quarter, we'll try and bring somebody in. So tomorrow night, we're actually going to have somebody do a guided mindfulness with Tibetan bowls. And next month, we're actually going to try it for the first time on Zoom. We're going to do an art therapy and we're going to get the supplies to everyone in their hands before. So that's been pretty well. And, it ebbs and flows as to what, who's coming. We do have 2 new women that are probably going to join for the first time since we've gone virtual. We've been doing it now 3 months since the pandemic started. We have a pink out, so similar to what you described, it's an all-day fitness where last year we did a Zumbathon for 2 hours, and that was a huge success. We had different instructors coming in and out throughout the morning, and people are asking for it. I'm trying to figure out how I can do a Zumbathon in the parking lot right now, but we'll see. And in addition to that, they can take other classes. Not so unique right now because as a J, we're offering virtual classes, so it takes some of the specialty away from it. But we're trying to figure out what we can do this year. But the other neat thing we do during that is we take over the lobby of the fitness center, and we have different organizations come in. We actually had a breast oncologist kind of ask the doc table this year, and that was pretty successful. We've had somebody doing a healthy food demonstration. We have the local folks from Force, the organization Force, have come in and they have a table, and some others, Cancer Support Community, SLOCA, St. Louis Ovarian Cancer. So we try and do that. And then we also have an oncology massage that we just rolled out at the J. And so last year we had the massage chairs out. So we do that. We do educational where we'll partner with local genetics counselors, and we'll do panels, and we'll have pre-vivors, survivors also talk as well. We have somebody very involved in the Sharsheret group that we have here that happens to be a PhD and also a pre-vivor. So that's pretty powerful when you hear her story. The other thing we've done is we've partnered with the book festival, and we've done that a couple of times where we have brought in an author with a relevant topic. And so they'll talk and they'll do the Q&A. And this last one, we had the author, we had Force there, we had a pre-vivor story there, we had a genetics counselor there. So, and then lastly, we are just started partnering with Tahara Israel, which is the mikveh organization here in St. Louis. It's a new relationship that we're building, and we're in discussions to do a partnership with them, which allows us to really bring in the whole mikveh education with the attendance and also the caring community component. So that's kind of what we're doing on our end.
That's wonderful. We may well be, I know some of you in your professional roles at the JCC, but there may be people on the call who are not JCC professionals, but members of JCC, or on the board or a volunteer at the JCC. So I want you to know that all these exciting things that Debbie and Shauna are talking about, if an idea moves you, if it feels like something you'd love to see in your community, we can help you work with your JCC and see if we can make it happen. But you did hear that they had both awareness and and support events, which is really nice. And I want you guys to know that we are just about to roll out. Thank you for coming, Amy. We are just about to roll out a new set of modules, program modules that can be done either in person or via online, some sort of virtual programming with some new programming opportunities, from new ways to do a Sharsheret Pink Shabbat, to a book club, to a knitting circle, and all of these are really awareness programs and not support. And if you're interested in getting some support programs into your specific community, not the ones we talked about, that, although you could contact me about those, but I'm talking about like ongoing programs, you can reach out and we can work on that together. Any other?
Yeah, Melissa, you talked about it, I don't know who's members or works for J's or not, but I will say that I don't know how all the structures of the J's work, but at ours, we have the J Associates, which is a very active, large group of women that I almost term them as an auxiliary fundraising leg of the J. And they have really taken a liking to Sharsheret and are extremely supportive. So if there is a similar kind of organization or group at your J, whether you work there or belong there, as a group of women, I would definitely see if there's an advocate in that group that could help partner with you guys.
Amazing advice. Any other questions about how to support someone in need, either as an individual or through the J community?
I don't have any questions. Sorry, Sam.
No, go for it.
Oh, I was gonna just add that in Atlanta, we've also partnered with genetic companies, and we've brought in doctors, and we've actually done BRCA testing on site, which I thought was really interesting. And we would also do the pink, but it's always pink on Wednesdays in October. So every Wednesday, if you wear pink, you get something special, and they write like, my workout is for, and then they post it on the fitness center wall.
I love
Like,
that.
yeah, it was so cute. And then it's actually funny, I'm wearing the shirt today under this, but it's too cold in here. And, but yeah, like we do a lot of that stuff. I've noticed though, for like support groups, they're not very successful. And I don't know if it's because Atlanta has a ton of support groups in areas. Like we do Parkinson's program, we do breast cancer programming, and it's every time we try to do stuff like that for support groups for the caregivers, it's not as successful as I'd like it to be. So I'd probably talk to you separately about how.
Yeah, we can definitely, I'm gonna make a note to reach out to you.
This is not a great, I don't know if I'm proud of this or not, but I will still share it. One of the things that really helped us pick, and I'm not responsible for this, so I can't even take credit, this was before my time, that picked up on the support group, was because we're at the J and we have a kosher kitchen, we offer, we provide a kosher dinner, a light kosher dinner before the support group. Let me tell you, things took off when you started feeding them.
Food always works for anything.
Totally.
If I give food, done.
Right, right.
And giveaways.
And
Giveaways are
Yes.
huge. Swag. Everyone wants to pick up something. Like it's amazing.
Absolutely. Now that may not work at the moment, as people who are dealing with a diagnosis are probably going to be the last ones to come out of their houses. But, you know, Valerie, I have a couple of ideas, including this might be the perfect time to start an online support group for caregivers, and then they can decide in 2021 or whenever it's okay to transition to a live support group or not.
Yeah, I would just add to that as we're thinking about transitioning in person to virtual and vice versa, that it's not, I really believe that the opposite of in person isn't necessarily doing virtual or vice versa. It might be that you find that doing something virtually is actually the way to go, and other things will be complemented by, when it's possible, by in-person gatherings and programming and stuff. So I wouldn't rule out the opportunity that actually maybe one of the things that will come out of this COVID-19 period is that there's things that people would feel more comfortable doing virtually, and more feel that it's more accessible to them from home than it is from coming to the J.
I agree with you, Sam. We started a yoga for cancer program at the J 3 weeks before the pandemic hit. All my grandiose plans. Anyway, but what we learned from this is that when we come out on the other side, we will always have a virtual yoga for cancer class.
Right.
We will begin offering it in person because the community is so powerful. But as you said, there are 2 women in the class today that said, I would not come into the J or any yoga studio, pandemic or not, when I was, in the midst of my treatment.
Yeah.
And the only reason I'm here is because you're virtual.
Yeah.
Another cool thing that I think has come out of this is a different kind of sensitivity. So now that we're all understands that, what social distancing is, and, we're starting to do, here we're starting to do more outside set up kind of, spending time with friends. So somebody who says, well, I'm immunocompromised, it's not like, I don't know what you're talking about,
Yeah.
Like my dad went through a kidney transplant. No one was allowed in the house for months and months and months and months. And now it's like, oh yeah, that's what we're all doing. You know what I mean? So some of this is gaining a new kinds of sensitivity that I really, really pray that a lot of these things don't go away, because I think it's amazing. Like I bought a 10 by 10 thing outside my house, and I can sit outside with, covered so nobody's in the sun and nobody's, and like we should never take that away the whole season. So, it's not just I think that piece is really helpful for people who are going through things, because now things to them that are totally normal are normal to us also, because we're all doing it anyway. So yeah, that piece is definitely something. And I definitely agree with everyone about some of the programming that not everyone would have been comfortable with doing in person. I love exercise classes. I will not go to one because I am too embarrassed. I've done like 1,000 of them sitting in my house. So, it's a piece that everyone's going to have to really evaluate. I know all JCCs are looking at this right now. Ours is certainly looking at it. But we do obviously crave that in-person feeling of just closeness that is very hard. The other thing that I find really fun, and whenever someone does this to us, I have 3 very little kids, and we each have, my husband and I each have a job. So we have, I don't even know what's going on here. But people drop things off, whether it's a little gift or, whatever it is. That's like a huge deal. So, my daughter's starting kindergarten, and her new school dropped off a t-shirt, and it was like, oh, wow. So if maybe people want to make up, like I know Sharsheret does busy boxes for moms who are going through treatment, maybe even making up your own, or even making up, I don't know, some things, somebody loves, crossword puzzles, whatever it is, and give them a little gift bag. Obviously there has to be some kind of resource behind that, or stuff that's, I don't know, easy to get or donated or whatever it is. Dropping things off with people is like, I don't know, you feel like $1 million when someone drops something off for you. Right now it's the Amazon guy, right? Like every day we get things from Amazon. I don't even know what's in the box, but when it's personal, I think that's very meaningful. So just,
you know what? I think that's a great idea. And should an organization want to do that, we actually have a pilot version to share with you. It's something that you guys do on your own. Unlike BusyBox or Best Face Forward, where Sharsheret National will send it directly to a caller. We have guidelines to create bags for those who are newly diagnosed or going through treatment, and what to include. And there are ways to organize like all different parts of the community to be involved with it, from donations to creating to delivery. And we have things that specifically are helpful to those going through cancer treatment, and they're all relatively inexpensive. You can do that just for your members. You can build a relationship with a local hospital and deliver it to anybody who's been diagnosed and is in treatment. But there are a lot, if you're interested in that, we can send information about that as well.
Melissa, it's on my list now for Thursday to talk to you about it. The one thing I get a lot of from the ECC at the J and from some of the synagogue congregations, they're always asking me, what can our PTA or PTO, whatever they call it, what can they do? And I'm always at a loss for what they can put together that the kids can be involved. So that might be something that we can really take
I will
advantage of.
share that information via email as well. Perfect. I promised Samantha we'd do 45 minutes, so I appreciate this. Valerie, I'll be in touch with you about some of the things you mentioned. Debbie, I know we have a call scheduled for Thursday, so Shauna, we should make a call.
Yes, always. But if you can send that out, like that would be great. I could start.
Absolutely will. I'll get that out before the end of the day today.
That'd be amazing. Thank you so
Thank-
much.
Thank you, Melissa.
And
Thank you to everyone.
for helping arrange this.
Thank you.
All right, take care.
Bye-bye.
Bye bye.